Welcome back to the TRG seminar for another week. Thank you for joining us again. This week we have, I think, what will be a very timely, at least as timely as you can get in the research world seminar. Today's seminar will be talking about the impacts of COVID-19 during and after the period. And we have three researchers that will be talking about this issue. And to help us through this talk, we have Sally Gainsbury, who is actually going to be one of the speakers, but she'll also be moderating and pulling double duty. So if you have any questions, as always, please feel free to put them in the chat box and we will answer them as we go through this seminar. But for the time being, allow me to hand the conversation over to Sally Gainsbury.
Hi everyone, and thank you for joining us on the Technology Risk Gambling webinar series. I'm Sally Gainsbury. I'm Associate Professor in the School of Psychology at the University of Sydney and founder and leader of the Technology Addiction team that is sponsoring this webinar at the Brain and Mind Centre. I'm very pleased to have this very timely webinar on the research of the impact of COVID shutdown on gambling, and we've got two fantastic speakers to join me today. Hakansson is a professor in addiction medicine at Lund University in Sweden and consultant physician at the Gambling Disorder Unit of the Healthcare Region Skåne in southern Sweden. His research focused mainly on behavioural addictions with emphasis on gambling disorder, including psychiatric comorbidity, epidemiology, gender aspects and responsible gambling tools, as well as legislative and preventative measures against problem gambling. Steve Sharman splits his time between two institutions. He's a Society for the Study of Addiction Academic Research Fellow at the University of East London. And he's recently appointed the National Addiction Centre's first Research Fellow in Gambling Studies at King's College London, where he researches environmental influences on gambling behaviour. Steve also works closely with the National Problem Gambling Clinic in London, investigating the construction and evolution of gambling-related harms. All three of us have recently conducted studies in our various jurisdictions of the impact of COVID-19 and the related shutdowns on gambling behaviour and gambling harms. So we're going to be today presenting not necessarily too much on the in-depth of the results. Some of these are still pending under peer review and will be published soon. However, we will be talking about the broader issues. What is the impact of this on research and how can we look at availability of gambling and the impact on gambling-related harms? So I'm going to start by handing over to Anders to give a short presentation and a few slides, and then we'll talk to Steve and hear some of our early results before getting into our discussion. Anders.
Thank you very much, Sally, and thanks a lot for inviting me. It's really nice to be part of this interesting webinar and to be focusing on, like you said, a very timely topic, which has actually been quite debated in the setting where I work in Sweden, in a country that's obviously in some focus due to discussions around its COVID-19 strategies, but also a number of public health issues that have been discussed related to COVID-19. So I will be really brief, like you said. I would just like to raise a few, suggest a few possible mechanisms about why is it interesting to study gambling in the context of COVID-19. Why is that one of the public health issues that have come up in the debate around this pandemic? And I think some of these possible mechanisms, they may apply very differently to different settings, and I think they probably already do. One possible mechanism is the fact that the COVID-19 creates a financial and employment crisis. There's worry about the future, and there's unemployment and increasing financial problems, which could potentially create mental health problems. And I think this kind of mechanism would probably also apply, for example, to alcohol drinking as a consequence of COVID-19, a public health challenge that increases in hard times. And that would, I would personally believe that would be more of a long-term consequence when it comes to gambling, more than a short-term change. Then other possible mechanisms are related to the restrictions themselves, to the actual lockdown or the actual confinement as a reaction, as a response to the COVID-19 pandemic. And this has been, at least in my setting, this has been very much discussed as a possible, the possibility that people simply spend more time online because they don't go to school physically, but do their schoolwork at home, the university studies, or because they are unemployed for some time or partially and spend more time at the computer or in their home. But also, which I believe is also a part of the discussion, at least here, is that people with problems may lose the treatment or support that normally keep them away from gambling, such that GA groups or other support groups or even treatment facilities counsel what they typically do and how they typically treat people for their disorder. And then there's also the discussion around the actual changes in gambling market, which were more of the acute nature, mostly, at least in my setting, but also in many settings, and we will get back to that, because of the lockdown of sports and probably some other lockdown consequences on land-based gambling. I think this mechanisms, and I'm sure we'll get back to this. This depends very much on how land-based or how online-based your gambling market is. If we look just briefly at my second slide, I would just like to state also that it's clear that many people, groups of people, will be affected when it comes to gambling by the COVID-19 in very different ways. And I think I think many people would agree that most people will not be very affected by it, as either because they are not gambling at all or because their gambling pattern is not changed at all by the pandemic. But there are different mechanisms, and we won't get into those in detail maybe, but clearly there are different consequences for those who already have a developed gambling disorder and who may depend on going to treatment, for example, compared to those probably or potentially initiating a risky gambling pattern. I think the major discussion in my setting, and we'll come back to that, has been whether people who typically gamble on sports or other things which are not quite the most risky kind of gambling, whether they did turn to another type of gambling, which would or could theoretically be worse from an addictive point of view. So that was just a very brief introduction to sort of some points to be raised about this issue. Thank you.
Thanks very much, Anders. And Steve, for your overview.
Yeah, great. Thanks, Sally. Thanks everyone for having me here tonight. I'm just going to talk a little bit about gambling in the UK in lockdown and some of the changes we've seen in behaviour. So the UK government were arguably quite slow to implement a lockdown. In fact, it was actually the Premier League, our main football division, was actually shut down on the 13th of March. So that was actually shut down before the nation went into lockdown. And there is an argument to be made that it was actually the Premier League's decisive action that eventually kind of forced the government's hand into pushing the country into lockdown. But when it did happen, lockdown had a big impact on the gambling industry and gamblers, as casinos and bookmakers were closed. Many major sporting events were suspended, such as the Premier League or the Wimbledon tennis tournament. We still managed to get the Cheltenham Festival on, so there was still around 150,000 punters kind of crammed into one space. And although there were some forms of gambling still available, the changes that we saw did fundamentally shift accessibility and availability of gambling opportunities in the UK. Now, as researchers, obviously we do see this as a research opportunity. Now, I guess I should always, whenever I hear non-researchers talking about research or seeing researchers talk about research, you can see kind of the look of horror that goes across the face in the way that we talk about things sometimes. So we ought to just preface this slide by saying that obviously we know that the COVID-19 pandemic is a huge global catastrophe, but as researchers we are trying to look for research opportunities and this happened to be one, this natural change in gambling provision provided us with a research opportunity that we've just never really had before, with this huge, large-scale change implemented at quite a short notice. So for some of the research we did, we just wanted to capture some of the immediate changes brought on by gambling, in gambling behaviour brought on by lockdown. So we just did an online survey of a few people, over 1,000 people, looking at their gambling behaviour, measuring some mental health impacts to sort of try and see some of the wider impacts and how gambling relates to mental health. And the idea really was to capture some short-term behaviour change initially, that initial short-term behaviour change in lockdown, to give us sort of a lockdown baseline to then look at longer-term behaviour change, which I think is probably the more important kind of thing that we need to look at here. So I'm not going to go into what we found in too much detail, because as Sally mentioned, there's still kind of papers that are under review in various places. But just as to give a really brief summary of some of the little bits that we did find, we found that gambling kind of stayed roughly the same, although online gambling increased. All land-based gambling dropped, which you might expect. There wasn't huge amounts of increases in online gambling in our sample, which is again something that we didn't exactly expect to see. But the interesting findings came when we looked by pre-existing gambler risk category, and I think this is it's kind of similar to what Anders mentioned. It's people who have a pre-existing relationship with gambling who seem to have been more severely affected by lockdown. So our gamblers that were in our study that already had showed some kind of risk profile, they were the ones that reported that their gambling had increased in terms of time spent gambling and in terms of money spent gambling. So it does seem to be that if you already gamble and if you already have that relationship with gambling, then you are at greater risk during lockdown. Gamblers also had high levels of stress and depression and anxiety than non-gambling groups, and seem to perceive an increase in marketing communication through social media and direct email communication, which is quite concerning. And that's a kind of a brief overview and a brief whistle-stop tour of what we've done in the UK. So now I'll just hand you back to Sally.
Thanks. And I'll briefly talk about the findings we had. There were some slides, but maybe they've gone missing. That's okay. So our study was similar. We looked at a self-selected sample. So we put posts up on social media. We didn't use a panel. So it was a bit different in the recruitment method from some of the previous ones. And we looked at how people's gambling had changed during the shutdown. The findings are available if you go to the Brain and Mind Centre and Gambling Research website, so you can download that report, although the results are under publication as well, more detailed results and breakdowns. We found that, again, 3/4 of people did say they had reduced their gambling in terms of frequency, and that included for online gambling. Most people were gambling online similar amounts or lower than what they were doing prior to the shutdown. We did find that 18% of people did increase how much they were gambling online, and these people were more likely to be experiencing gambling problems, psychological distress, and financial difficulties, which were both focus of our research. However, we found amongst people overall who were experiencing gambling-related problems, that 60% said that their gambling problems had reduced during the shutdown period, which was obviously a really positive finding. And some of the qualitative insights that people provided when we just provided free response options was people really saying that the forced break from the gambling venues allowed them the opportunity to take a break, to reflect, to realize how much time and money they were spending. And they were really hopeful to have this opportunity to change their gambling behaviors. And there were also a lot of people saying they did recognize they had less money available, so they weren't going to gamble as much. So although there was a small proportion of people who did gamble more, not all of these were problem gamblers or people experiencing harms. And some people who did have gambling problems, or most people who had gambling problems, took the opportunity for the benefit of what it was. So I won't talk too much more about the findings, but what I want to talk about is, I think, really some interesting things that we can look at between jurisdictions, given that Australia, the UK and Sweden really had different responses, with Australia shutting down very quickly with stay-at-home orders, the UK taking a lot longer to do that, and Sweden having much fewer requirements to shut down and stay at home. Yet still we had similar impacts on gambling and gambling behaviours in some of the surveys. So I might start with Steve and ask you, you've mentioned about what this allows us to study, this natural experiment, and we could definitely have, I'm sure, a whole hour talking about how to throw research together really quickly and what not to do. I'm sure we all learned a few lessons during that process, but really think theoretically, what can we tear from these results apart from the focus on COVID-19 specifically, more generally about what happens when you do change the availability of gambling behaviour?
Yeah, so I think for us, one of the things we really wanted to look at was to really understand how the enforced changes affect behaviour both in a short and a long term kind of way. So are the changes that we're seeing in lockdown just a short term change as a result of this very particular set of circumstances? And when this is over, are gambler behaviours going to just revert back to old patterns and old habits, or are we seeing something that's more permanent? And I think for us, that's the most important question, is to really establish kind of which of these changes in circumstance kind of drive the short and the long term changes. Because I think it's really interesting what we had over here. We've tried to measure this kind of the short term impact, but then we've had the reintroduction of sports gambling almost in a binge kind of way, and that the Premier League was suddenly back, and there was games happening every day. And we've now just got the latter stages of the big European tournaments like the Champions League, and it's staggered so that there's something happening every day. So people who gamble on sports have gone from having relatively nothing, pretty much nothing to gamble on for a long time, to having something significant every day. So therefore we don't know what the longer term impacts are, and the impacts of having kind of gambling opportunities removed, and then how they're being reintroduced is going to impact on those short and longer term kind of behavioural changes. And that's something that we're really interested in carrying on monitoring and looking at.
And as obviously Sweden had a different lockdown situation, do you want to briefly talk about the situation and what happened in Sweden and the impact that you were studying?
Yes, I think the major impact, at least what has been discussed in Sweden, I think the major impact was the lockdown of the world of sports. I think that was the major change, because the Swedish gambling market is very online based, and the vast majority of treatment seeking patients, for example, present with an online gambling behavior. Very few people with intense gambling habits actually gamble in a land-based manner. So it's very much online. So the only physical lockdown effect apart from sports was that the 4 state-owned physical casinos were closed, and they've been closed. They are still closed, and casinos play an important role in this context, but they are rare as the type of gambling reported by treatment-seeking patients with a gambling disorder. So most of them do gamble online. So I think the major change that happened was actually the lockdown of sports.
And in terms, that's interesting about the online being more likely to be related to problems, because theoretically then that wasn't changed other than the reduction of sports betting opportunities. So why do you think there was a shift, or was there a shift then in gambling behaviour or gambling harms, or did that just continue or accelerate due to some of the other factors that you mentioned? Or do you think some of the land-based people did migrate to that form?
Yes, the fear that actually came up from both from politicians and other stakeholders in the area very early in the pandemic was that the lockdown of sports would not affect the majority of people of gamblers in Sweden, but that people with very intense sports betting habits would turn to online casinos. I think that may have happened to a relatively limited extent. In the general population survey that we did, a majority responded that they had responded to the lack of sports through an increase in online casino gambling. So a minority, quite relatively few people did that, but those who did had a very high reporting of the PGSI measured gambling problem. So I think, again, that shift may not have occurred to a very large amount of people, but it may have occurred to those who were at particularly high risk.
And Steve, similarly, in the UK, online gambling is quite widely available. So that, other than the sports, shouldn't have been too broadly impacted. So in this terms of this switching, is there some of this just transference and spending money they would have spent on land-based venues online? Is it new people online, or did you also find an increase of people with gambling harms more likely to be increasing? You know, is this sort of this migration effect? If you shut one thing down, it's going to put people in another bubble, or do the people whose preferred choice is not available simply take a break from gambling?
Yeah, I think that's a really difficult question to answer, because I think as with all questions relating to gambling behaviour, it's very difficult to provide a general answer, because gamblers are so different in terms of what they gamble on and the reasons they gamble on certain things. But I mean, from our data, we've seen that we have these kind of slightly unusual results in that we'd seen quite a large increase in the proportion of people who were actively engaged in gambling, who gambled online. So if people already gambled, the use of the internet to gamble had increased hugely in lockdown, which does suggest that those who may have been using land-based forms previously are now gambling online instead. But what our data didn't show was any particular increases in specific forms. So it was almost like people were telling us that they were gambling online more, but not actually telling us what they were particularly gambling on. But I think, again, there's kind of these different groups. Like I was quite amused anecdotally by my my father-in-law, who's quite he gambles on horses fairly regularly, but once lockdown started and the bookies shut, that's it. He had no interest in putting a bet on, because he has no interest in online gambling. Whereas we know that there is other data out there in the UK. So, for example, the Gambling Commission have released some statistics that has shown that there is migration from, well, it doesn't necessarily show where from, but shows migration to other specific forms. So we know from year-on-year data from the Gambling Commission between 2019 and 2020, for months out and in lockdown, there's been quite large increases in casinos and slots and online poker. So we do know that there is this shift in kind of forms that people are playing. We also know from the Gambling Commission data that engaged gamblers are gambling on more things, and that they're more, if people who are engaged in gambling already are more likely to have tried a new form in lockdown. So I think there is definitely evidence from the UK that does suggest that it is people are gambling more, and they are gambling. People who already gamble are gambling more and are trying new things and are maybe picking up some new habits.
And from the Australian context, in Australia, we have legalised online wagering and lotteries. And although sports were shut down, races continued to a lesser extent, but horse races and things were still being run. So that was still an option. So that form of online gambling was less affected. However, of course, in Australia, electronic gaming machines, or pokies as they're referred to here, make up 2/3 of gambling expenditure, and they're highly related to gambling problems. So all of those were shut across the whole country. And one of the concerns that's been raised a lot in response to policy options about whether you would restrict access to gaming machines or place restrictions is that everyone will just go online, and that would be more problematic because people would be going to offshore pokies sites. And we didn't find that in our research. We found that most people did reduce their gambling. Now, our sample, because we recruited from social media and online, were more active online than the representative sample would be of just poker machine players. But we did find that some people sort of dabbled, but it's difficult also to say when you're doing a survey, for example, in May, and people say they've bet on esports, does that now mean that they're going to regularly do so? Like, it might just be that people tried esports once, tried online poker once. And we did find that obviously things like, Netflix subscriptions, like in the month of May and April, people were just doing all sorts of things. Everyone's baking sourdough bread in Australia was a big thing for some reason. You couldn't actually buy flour in the supermarket because literally everyone was making sourdough bread. So these sorts of changes, they were in this pandemic of all these things going on. It doesn't necessarily reflect what would happen if these sorts of policies were put in place in the longer term. So I think it's really interesting to look at the fact that some of these fears didn't really come to pass, where we found 60% of our people with gambling harms actually reduced their gambling problems and were not switching to online or doing so in a lesser way, because simply using online doesn't all of a sudden mean you're spending the same amount you might put through other forms of gambling. So I think that ability to differentiate between different groups is really important. So what I want to talk about is both of you are working, or at least affiliated with, treatment clinics. So perhaps, Anders, have you been seeing any, what's your experience been, or has there still been treatment provided? Who's coming to seek treatment at the moment?
Yes, that's also one of the very difficult questions, I think, in this issue, because our treatment seeking decreased markedly during COVID-19, but it did also for alcohol use disorders and for drug use disorders, and in the mental health department where I feel sort of linked to where I work in the emergency setting, fewer people sought treatment, and of course not reflecting a decrease in problems, but mainly because people didn't want to go to the hospital or didn't want to go to units to mix with other people, and because of fear of being infected. So I think those measures are very, very difficult to apply to this. Now, we had a considerable decrease in treatment seeking, and now we are seeing some increase, which is very difficult also to judge. What we do see, however, is that the patient organizations who work voluntarily outside the treatment system, they report an increase in people applying for their help, or people seeking some kind of assistance, or they see an increase in the interest in what they do, which might reflect a larger number of people with problems, or it might reflect a more intense debate. I must say they also had a larger interest, a larger amount of people seeking when the self-exclusion system in Sweden was introduced, for example. So ironically, something that decreases problems may also increase the interest and the debate around it, and more people will seek treatment. So I think to be brief about that, treatment seeking may be a difficult measure here.
And in Australia, there was a drop-in call to the gambling helpline as well. However, in our treatment clinic, we did see a relatively steady continuance of people seeking help. We switched to providing treatment via Zoom and telephone, so the accessibility was actually better in some ways. And we did have better treatment attendance, fewer people missing appointments because they were online, which was a really nice opportunity to try out remote technology, which we're going to continue even when we're allowed to open again. But we did have sort of a mixed result of some people saying this is a great opportunity. They really wanted to take advantage of this forced lockout of venues to overcome the gambling problems. However, some people were saying this is great. I don't have any gambling problems anymore. I haven't gambled in a month, and really not recognizing that risk that when the venues reopen, that they'll flood back in. And Steve, I believe things are still somewhat shut down in the UK, but in Australia, or at least in some states of Australia, because we have a bit of mix between states. But when New South Wales venues reopened, there was a huge jump in poker machine losses across the state. It was about 8%, but if you break it down into different regions in some of the away from the coast, which is often associated with less socioeconomic success, in some of the hotels it was above 30% year-on-year increase in poker machine losses. So I wanted to see what you're thinking from your treatment experience and association. What's going to happen when venues do reopen?
Yeah, it's really difficult to predict that. I mean, I can't speak for all treatment providers, but I know that for one that I have spoken to, they said they experienced a large increase in demand for service during lockdown. They also noticed an increase in people who had reached that kind of point of feeling suicidal because of their gambling, which again, the reasons that lockdown have kind of created that situation, we can definitely talk about probably all night. But in terms of venues reopening, it's really difficult to know how it's gonna impact, because like you said, we've had this kind of move to push gamblers online. Partly it's been forced because of the circumstance of the land-based venues being shut, but there's also been things like, we had the virtual Grand National. So our Grand National, our big horse race, was put as a virtual horse race event, which obviously you could only gamble on online. Now, we know from previous prevalence studies that there is this kind of proportion of gamblers that are very, very infrequent, and they may only gamble once or twice a year, and the Grand National is something that people do gamble on as their singular event for the year. But we've now got this whole kind of extra group of people that have now created a gambling account because they wanted to gamble on the virtual Grand National. So whether we'll see a flood back to land-based venues, it's kind of difficult to know, because we don't know whether any changes in terms of land-based or online excuse me, are temporary, or whether they're going to be permanent.
Definitely. In our survey, we're sending out follow-up. So we're going to try and follow a subset of the people in our survey over a few waves to see what happens, particularly given that when we did our first wave, the whole country was essentially shut. And now Victoria is still completely stay-at-home lockdown, whereas other venues are open, but there are some cases, and there are other parts of Australia who are relatively COVID-free and open, although with closed borders. So it'll be really interesting going forward, hopefully, to look at the differences between states where there are differences in availability of gambling. And it would be great if there was ability to do further nationally representative surveys. So hopefully we can progress that. But I want to focus on some of those positives, because in Australia, given that poker machines are so associated with gambling problems, arguably for a lot of people, and there've been a lot of media about anecdotal reports of people, how much money they saved. And interestingly enough, while some people were in extreme financial distress, or a lot of people, lost their jobs, lost their incomes, huge financial impacts, for some people, this was actually a financial boon. They stayed at home, they worked from home, they didn't do anything, they didn't go on holidays, they didn't spend money on pokie. So there's this really mixed effect and how people obviously responded to that. So I wonder, from Anders, what your thoughts are about the positive impacts, and whether in Sweden, there were some really drastic measures taken during the past few months, with a mandatory weekly deposit cap, limited on bonuses, and there's now been a recent talks about actually having lockdown limits permanently put in place, where you can only gamble of certain hours of the day. Do you think this insight into what happens when availability is drastically reduced will have ongoing effects going forward?
Yes, but both yes and no. I think we haven't had much of a discussion around the positive side of it. I think possibly because the machine gambling or land-based gambling isn't very common anymore in Sweden. It's so online based that not so many people talk about this, not going to the casino anymore, not going to the machines anymore. There hasn't been much of that debate. But you're right, saying that Sweden has taken quite drastic interventions, actually, which have a very broad political support, and I think also a very broad support from the general population. And I think one reason for that is that Sweden changed from a state monopoly a few years ago that was virtually not functioning as the internet came around and brought in a lot of overseas gambling companies. So it changed from that into a very online based market with a very large number of online casinos, quite predominating in television advertisements, for example. So I think there's a general population support in favor of some quite strict restrictions onto online gambling, and that's probably part of the explanation why such drastic measures were taken.
And Steve, in the UK, the Gambling Commission in the recent years has been taking more and more of a focus on restrictions, with the recent £2 betting limit for fixed odd betting terminals, the banning of credit cards. And in some sense, it seems like this COVID situation, as you've already mentioned, is accelerating what was already happening. It seems to have already happened in Sweden, that everyone's just gone online. Land-based gambling is, it really is more of just an entertainment activity for when you're out and about. Australia and the UK still have a fairly active land-based gambling venues, but people are accelerating to go online. Is this just sort of accelerating that migration that would already happen? What do you think and you've sort of briefly touched on the ongoing impacts, but what are your thoughts going forward?
You mean in terms of the migration from land-based to online gambling?
Yeah, the migration and potentially what the policy reaction might be.
Right. Yeah. So I mean, I guess, yeah, we all know the world is becoming more and more digital. So gambling is going to become more and more and more of an online-based activity. I think that's something that is unavoidable. And you're right saying that there's definitely been a busy legislative time kind of in the UK this year. There's been quite a lot going on. I think kind of the big push at the moment, obviously we just had the Lords report came out recently, which has made quite a few strong recommendations in how the shift in legislation perhaps should fall within the gambling industry, and how it should be legislated, and how it should research, education and treatment should be funded, and all kinds of things like that. But I think the big thing will come if and when we get to review the Gambling Act. The Gambling Act of 2005 was obviously written quite a long time ago. It's not up to date for the digital age. So the tools that the legislator are armed with are essentially massively out of date in terms of legislating the industry that they're supposed to be taking care of. So I think once we actually get around to do that, and we update the Gambling Act to bring it in line with the types of gambling that are available and the modes of access for the gambling, I think then we'll start to see some proper legislative change.
And two of the questions that have come up are about specific forms of gambling. In our study, we didn't look at, I suppose, too much outside the traditional gambling. We did find an increase in private betting, and I know anecdotally people who've switched to playing poker online with friends as their kind of Friday night activity. Instead of going out with friends, they're playing poker together. We did see an increase in esports betting, which has been relatively on the periphery, but that increased because obviously that was something you could bet on that wasn't affected. Those events could still run. Has there been a shift to something like day trading or other types of betting-esque activities? Have either of you looked at that or thought about any of those ideas?
Anecdotally only, like you said, but I can't say we've studied it, and I think that we don't have any systematic data supporting that, but also not the opposite.
Yeah, so one of the things that we were also interested in, but we didn't manage to capture yet within this particular study, is we are really interested in to look at the impact of other forms of behavior that some people say are gambling, some aren't. So for example, loot boxes within computer games, we're really interested to see how that has changed and how that relates to lockdown, because there's been anecdotally, again, there's been an increase in kind of video game playing as well, with people being stuck at home more. But what we haven't managed to capture is one of the inclusion criteria for our study was that we wanted people to be 18 years of age. And we're really interested actually in seeing how that younger generation are impacted by these newer forms of gambling. And that we won't actually be able to study yet and can't look at whilst we're including people who are over 18. So it will have to be a new study that actually is able to look at those younger participants as well.
Yeah, that's interesting you mentioned that, because in our study we looked and found that the youngest age group, the 18 to 29, were the most likely to have increased their online gambling during the shutdown. There was, fairly similar-ish amounts, although a little bit less amongst the 40 to 49 age group. So it's certainly not saying that it's all about the young people, but obviously when it comes to transference to online, the younger generations are more likely to either just do that from the start or migrate to that. Anders, did you look at youth as something in your studies?
Sorry, could you please repeat? Did I look at
the age factor of whether there were differences between different age cohorts?
Yeah. As far as I remember, there were not considerable differences across age categories? No, not as far as I remember, no.
And is that typical, do you expect? Do you see an age differential in Sweden in people experiencing gambling problems or who are gambling intensely?
They are typically quite young. What we do see, and what I think has been seen in many settings, is that men and women gamble very differently, and that there's a quite considerable age difference between treatment-seeking men and women. I think it's very difficult to. I think it's difficult to know what effect that will have. I also think one aspect of this is not the short-term aspect of a changing market, but very much the aspect of what happens when we go into financially hard times, probably over a couple of years or several years due to this pandemic, and the risk of poor mental health sort of translating into increased gambling problems as well as alcohol problems, for example. And there, I mean, what happens there is something that we really need to study, I think, far beyond the acute phases of the pandemic and these quite rapid alterations in the markets. Like, for example, if I just expand on that, like in my setting, a very strong impression is that many of our patients have quite severe mental health problems, where gambling, a very severe gambling disorder, plays the role of it's one part of a very difficult socioeconomic and mental health situation, where I believe that kind of picture is very likely to increase in hard times, regardless of whether it's a pandemic or something else that has caused it.
Yeah, and Anders, I think that's really interesting that you mentioned the socio-economic status side of it. So one of the interesting findings from our first study, which actually I think, Sally, it seems to contradict stuff that's something that you found within your study, is that one of the demographic variables we looked at, one of the questions we asked, I should say, was how people had been financially affected by lockdown. So we asked, we wanted to know if people had lost their job or if they'd had decreased hours, and it was that group that felt that they had been negatively financially impacted by lockdown. They were more likely to feel like their gambling had increased whilst in lockdown. And for us, that was a really worrying finding, that people who are finding themselves in a much more financially difficult position were the ones that seem to be turning to gambling as a way of kind of finding a way out of that financial hardship. And that's a very concerning finding, and it's something that we really want to keep a very close eye on, just to make sure that that's not a longer term pattern, because that's going to have quite severe negative impacts for those people, and that's going to affect quite, like, there's quite a large number of people. I think there were some figures came out recently saying that unemployment, in fact, weirdly it was phrased as employment is at its lowest rather than unemployment is at its highest. So there's a large number of people within this country, and I guess within countries worldwide, that are going to be negatively financially impacted by lockdowns and by the pandemic, and it's really worrying if it's those people who are turning to gambling as a way out of that.
Yeah, that's a really important point. So we specifically included several measures of financial distress or financial well-being rather in our study. And we also asked people, what changes to their employment they'd had during the COVID and whether their financial situation had been negatively or positively impacted. So although in our self-report, some people were saying they were gambling less because they could afford it less, amongst the people that did increase their online gambling, 30% of these were financially worse off after COVID or as a result of COVID. And so we certainly did see this financial impact, people increasing their gambling, which is hugely problematic. Similarly, as we look at the venues reopening in New South Wales, we've seen a difference between socioeconomic areas, with some of the regional figures of increases in poker machines spent year on year in the month of June when their venues reopened were huge jumps. And that's really problematic because these are some of the same groups that are currently receiving economic stimulus packages. So in Australia, we have government support specifically for people who've lost their jobs because of COVID and for businesses to keep employing people, as well as there's been a few one-off economic payouts. So the fact that we're seeing an increase in losses at the same time as these stimulus, and more likely amongst people who are in geographical areas with lower socioeconomic status, is really concerning because, you know, as you've kind of mentioned, Steve, when you start to change your behaviors, it might be a one-off, like going to open a betting account to bet on one specific thing, but then those behavioral changes can have long-lasting impacts. If you start to gamble in a way to deal with your negative emotions, if you open an online wagering account, often operators actually make a bit of a loss leader to encourage you to open your accounts to bet on major events. In Australia, we have the Melbourne Cup, because then they can market to you. Once you're a customer, the marketing rules are really different of whether you can be provided bonuses, promotions, direct emails. There's a lot of restrictions on doing that to people across the population for non-customers. But once you have an account, you're all of a sudden a customer, and the marketing rules are very, very different. So the impact of people who might have sort of dabbled in this, who might be experiencing financial distress, trying to cope with it, the long-term impacts are going to be really critical to look at. And it'll be really interesting to see as the venues reopen in Australia. One of the interesting findings about the reasons the losses are so high, about half of the machines are actually switched off because we have social distancing requirements. So you can't sit next to someone. So venues have pretty much either spaced out the machines or turned every second one off. So there's actually fewer gambling machines available, yet we've seen our losses go up. So with the venues paying so much attention to social distancing and health hygiene, it's going to be really critical to see, given that they've had such economic losses and the government has had huge economic losses with less gambling income, where the balance is in getting some of those revenues back up to usual versus paying really close attention to who's actually gambling and what is the risk that they have. I don't know if either Anders, you were nodding if you have any comments on that.
No, I think that's very relevant. In our survey also, we saw that those who reported an increase in gambling, in many cases, they also reported an increase in alcohol drinking, for example, during the pandemic. So I think there are good reasons to believe that this affects a small or a limited group of people, but it affects mainly people with high risk of different kinds of problem already. So again, it hits people unequally to a large extent. I guess we would. Let's hope we can keep the energy in this issue and keep studying this for not just for these acute or subacute phases, but also for several years, so that we can look at all aspects of this. I think this is definitely this. There's a risk that this will be one of the sort of less expected health consequences of a pandemic. Not so much now, but over a few years.
That's a really good point. As we come towards the end, perhaps, Anders, you could elaborate on that, how this might impact what you would like to study going forward, how you're going to do research, provide treatment, or if you were to be advising the government, what would you recommend as strategies and policies to put in place during the pandemic and following the pandemic? Yes,
I think there are two major issues, or two quite diverse areas, and one is the prevention area, which has to deal with what television advertisements can be allowed, how to try to regulate social media based advertising for gambling, for example. So that's the prevention part of it. But the other one that I find very important is it will be to keep on integrating gambling into the mental health prevention and treatment setting, to put that in place and to make gambling one of the health issues to screen for, one of the health issues to treat, not separately as a very special group of people, but integrated with other mental health issues. And I think that this pandemic it's good for the gambling issue to discuss it in the same context as other socioeconomic and mental health issues. And I hope there will be both research energy in it and political will in that direction.
Yeah, that's terrific. And I would definitely concur with that. We're looking at doing that within our clinic, is using the sort of combination of clinic research and education to push the issue of gambling to be more of the forefront of health professionals. We know that many people with gambling problems also have financial harms, they have legal issues, they've got physical health problems, and there might be there's some research suggesting that before someone seeks treatment, they see 9 other professionals, and that if no one's asking those questions, whereas if they saw their doctor saying they're not sleeping well and their doctor had asked, well, do you gamble? A one-item screener with adequate knowledge to refer into treatment, we might be able to minimize harms. And similarly, we're also working with venues looking at staff training to start increasing staff's ability to really watch out for their players and have conversations and identify people who are at those low risks of harm. I think in our society, we've had a lot of focus on treatment as a problem, gambling, fix. Whereas there's a lot more we could do to prevent problems in the first place and provide interventions to help people before they get to those serious harms. Steve, I'll hand it over to you to jump in on that.
Yeah, so I mean, there's a whole range of things that we could do in the UK to move forward. Not least, one of the things that is an issue that's in focus quite a lot at the moment is the minimum age of gambling products. In the UK, we're not unique, but we're fairly unusual in that we have a whole range of products that are actually gambling products that are available to children, and we have our national lottery is available to 16-year-olds. So we would really like to see all gambling products be 18 and above. I think that would be a good place to start in some prevention. I'd also like to see in the UK some much tighter legislation around advertising and sponsorship, because in our Premier League and our Championship, our top 2 football divisions, we have, I think it's over half the clubs in the 2 divisions combined are sponsored by gambling companies. So the amount of time, even when you're watching our main highlights program that's repeated on a Sunday morning, when there's children watching, you've got over half the screen time there's a gambling company logo on the screen, so that we have an enormous amount of exposure. Even if you take away actual adverts, you still get a whole ton of screen time with the gambling company logos on. I'd like to see I've got a whole list there. I'd like to see more done on affiliates. That's something that we've not touched on at all. I guess that's probably for a whole different conversation. But kind of in terms of the wider environment, there's definitely a few big things that I think could be done in the UK to help help with gambling going forward. Particularly interesting hearing about what Anders said with treatment and the treatment setting. It didn't come in as a Lord's recommendation, which was surprising to quite a lot of people. But what we really want to see is the responsibility for gambling moved away from the DCMS, the Department for Digital Culture, Media and Sport, and actually move towards the Department of Health, so that we can actually treat gambling as a health concern rather than as something as part of culture. And the last one that is really important for a lot of us, particularly here in the UK with our complicated situation, is that we'd like to see more independence for the funding for research, education and treatment, because it's quite a lot of it over here is still quite intrinsically linked to industry funding. And that's a situation that we would really like to see changed before I can see that we can make a lot of progress moving forward.
That's a good wish list. I like it. I'm glad we had the opportunity to ask you that question. We're just in the process of wrapping up. Anders, did you have any final comments you'd like to make?
A very, very brief one. I think the consumer credit issue is also something to bear in mind, how to regulate people from taking loans after loans to pay one loan with a different loan. I mean, there's a pattern that in this electronic world, I mean, you can see the pattern of a person developing a problem gambling pattern when you look at how she or he is allowed to take loans. So I think that's one part of it in financial crisis such as COVID-19. Just one other aspect of it.
I think that's a really great note to make, that I think what both of you have really highlighted is the many different impacts that this COVID shutdown has had on people's lives, well beyond gambling, which is one aspect, but that gambling is impacted by these broad reaching issues, and that there are many organisations that do have potential roles to play, whether it's banks looking at income in versus gambling, loans being lent, wagering or betting companies with advertising and promotions, know your player algorithms to detect risk, governments obviously, and policymakers and regulators ensuring that the products environments are safe. And hopefully this opportunity, I think, has shown the ability for major changes to happen. And often I think there is this hesitancy in policy that, well, we can't do that, we don't know what's going to happen, or people won't like that, or something else will happen. But I think this pandemic has really shown that we can throw a lot of things out the window and really start from scratch if we need to, and if there's enough political will and motivation to do so. I want to really thank you both, Anders and Steve, for a really interesting and useful conversation. Both of you, it's very late in the evening, so I really appreciate taking the time for both of you in the preparation and being here live today. And I'm sure that there'll be many people who are able to listen and will follow up with both of you for questions. So a huge thank you to both of you. Thanks to everyone who's tuning in, and I'll hand over to Khalil now.
Well, thank you very much, Sally. And thank you again, Anders and Steve. Again, that was a fascinating talk, and something that I think that, I take Steve's point that as researchers, we look at natural experiments as good things to look at. Really, they're interesting things, even if they come out of obviously bad circumstances. But everything that you've discussed seems to have really brought a lot of trends that were happening, on an ongoing basis to the forefront right away. And it's on people like us as researchers, and it's on to policymakers and leaders in industry to really respond to all of these issues that have really come to the forefront now in recent times. So thank you very much for this discussion. And I know that all of your work will continue in this direction. So next week, we have a very unique webinar. The webinar is going to be our graduate student lightning round. So we have several different graduate students who are each going to give 3 to 4 minute presentations, followed by a single question follow-up. And looking at all of the different presentations that we've seen come in so far, there's some very diverse and unique presentations coming up. So I look forward to all of those, and I encourage you all to tune into that next week. But for now, I'm just going to say one more thank you to the Brain and Mind Center for hosting this webinar, and thank you to Harrison Stein, as always, for all of your work behind the scenes helping us to produce it. And thank you very much.